Now, Kenya has intensified surveillance and screening of travelers at the country's ports of entry in the wake of the declaration of mpox as a public health emergency on the continent. Now, the African Center for Disease Control has declared that the viral disease is a continental emergency following the spread of the disease that has killed hundreds across the continent since the beginning of the year. Let's begin our broadcast with our very own Brenda Wanga.
The declaration by the African Center for Disease Control comes as the disease, formerly known as monkeypox, continued to spread across the globe and in Africa. The disease had been circulating in the world from 2022 and up to date. In Africa alone this year, the African CDC says 2,863 cases of the disease have been confirmed, resulting in 517 deaths, primarily in DR Congo. The CDC also states that the number of mpox in Africa has now surged past the 17,000 mark from 2022, but contends that the number could be higher due to challenges in surveillance, laboratory testing and contact tracing. These cases are now hitting that much closer home on the continent. In the past few weeks, cases of mpox have been registered in Burundi, in Rwanda, Uganda, and one case in Kenya. The Ministry of Health says that case in Kenya was reported on the 29th of last month, but the onset of the case had been early in June. Consequently, 12 people who were in contact with the 42-year-old male patient 0 have been traced.
After the confirmed case, we had other contacts, people who contacted the confirmed case, and there were about 12 contacts, and they were traced. The contact tracing went on, and they were brought forward. Their specimens were taken, and really everything was okay, turned negative.
The ministry also states that there have been 20 suspected cases of the disease in 8 counties, including Nakuru and Nairobi.
But these are suspects, so not confirmed. And when the specimens were collected and taken to the lab, all the cases turned negative.
Kenya's patient 0 for the mpox disease has since recovered and been discharged, and the Ministry of Health says it is working hard to ensure that the situation remains the same with no cases in the country. To ensure that goal is met, the ministry says it has activated the emergency response mechanism, including surveillance, screening and monitoring of travelers getting into and out of the countries at all the ports of entries.
Already we have, as at today, we have screened 250,000 travelers that have been screened, and there is no suspected mpox case that have been detected so far from the screening that has been done. The sensitization on mpox is ongoing.
Further to the screening of visitors coming into Kenya, the Ministry of Health says it has activated all the 26 public health emergency operations centers across the country and has readied the 7 laboratories capable of testing for the mpox virus. It says it has also deployed 120 staff who are trained to handle outbreaks like this. But beyond the laid out steps to combat the disease, should it find its way into the country, the government says the declaration of the public health emergency situation now means that the African CDC will activate its mandate to lead and coordinate responses to the emergency. Brenda Wanga, Citizen TV.